Hello, and welcome to this conversation about getting the most out of your dermatology appointment. My name is Dr. Nabiah, and I'm an internal medical trainee based in London. And with me today, I've got Dr. Marisa Taylor, who is a consultant dermatologist, also based in London, and Bunmi, our advanced nurse practitioner in dermatology, also based in London.
Thank you so much, Nabiah. So the three of us are here for you. I'm from Skin of Color Training UK. I'm the CEO and consultant lead. I'm a consultant dermatologist at Epsom and St. Helier Trust. And with me is an advanced nurse practitioner. She is our nursing education lead. So very qualified to talk to you today.
So to kick things off, it can feel quite overwhelming when a patient gets a dermatology appointment. So do you have any advice about what they can do to prepare?
Preparation is key. Prepare, prepare, prepare. And the first thing that you need to do is have a list of all the things that you use on your skin, because ingredients, essential oils, fragrances can all make a difference in how your skin reacts and to the history that you give to your GP. So bring in a list of your medications, everything that you use, and all the treatments that you've used for your skin disorder.
And I guess that includes traditional and cultural remedies too?
Yes, of course. And we want you to bring everything in because we want to know what's been working for you, what has not been working for you, what you've used before, what you haven't used. Even if you have them at home and you've used them, you've thrown away the container, please bring the packages because they will have the names on them. It's good for us to have history of everything that you've used before and what you are using right now. So yes, including remedies, home remedies as well.
I think that bit about even what you've thrown away, bring in the package.
That's right.
That's a top tip.
Yes, because we tend to forget sometimes.
Yes,
and for us to get the right diagnosis for you and what works for you, what has not been working, we need to know the history of what you've been using.
Very true. And what about visual records? Sometimes conditions flare up, so can taking photos help?
So visual records are very important. And what happens a lot of times, certainly if you're based in the UK, patients would have waited several months for their dermatology appointment. So it is very likely that when you present to clinic, what you've come for is not there. And therefore, please bring in photographs. That is the first tip for anyone of any skin type. And secondly, because things evolve over time. So, initially it may look purple or red, and then it may change over time. So that's important for us as dermatologists, one, to assess what it may have been, because you may not have anything on the day, and also to assess the severity and the progression of the disease. A top tip for skin of color, however, is that inflammation or redness may not look red on darker skin. Yeah. It can look red sometimes, so let's just put that in. But sometimes it can look purple, gray, brown, ashy, and therefore photos again are very helpful for dermatologists because it's a very visual specialty. We like to use our eyes, and so photographs are probably the most important thing you can bring to your appointment.
You're very right, Dr. Taylor. It's best to keep record of your photos as well.
Yes.
Nothing is taken out of context.
Yes.
Just make sure you keep, regardless of what stage you are in your disease condition, just keep pictures. And no matter how many of them, we will look through them because it will help us to diagnose you better.
Yes.
Fantastic. And is there anything people should avoid before their appointment?
I mean, the major thing that we advise patients to avoid doing before coming is, if you are coming to us, depends on where the disease is, to avoid putting a coat on your face, especially women. If you are coming, we always advise not to wear makeup. If you are going to wear makeup, because sometimes, it's difficult for some patients to come out of their house without putting any makeup on because of the severity of their diseases. We advise you come with something to wipe those makeup off, and then you can reapply at the end of your consultation. The more we see how it is, the better for us to understand how severe your disease is. So if you are coming to us, we advise you can wear jewelry, you can, adorn yourself, which is okay. I love to adorn myself, but please bring something that you can use to remove that so you can see your disease, and then that will help us to diagnose better.
Very good advice.
Yes, it is. I think also bring your makeup to put it back on. Yes.
Oh, yes. Yeah.
That's right.
So I've noticed that patients are often very concerned about color changes or scarring. So how important is it to talk about hyperpigmentation or keloid scarring?
For patients, most patients actually, especially those with skin of color, many times they're not worried about the primary skin disorder. They are more worried about the pigmentary change, whether that is the lightening or the darkening of the skin. They're also very concerned about the risk of keloids, or that may be their primary concern, or hypertrophic scars. What I would say to patients is, one, some treatments can cause hypertrophic scarring, especially if we have to do surgical intervention. So please do tell us if you've had keloids. They're often on the ears, which may show, if you've had piercings, which may show some tendency to scarring. That would be very helpful for us to know, and that will change how we treat you. But also if you have a tendency for hyperpigmentation, and again, we will give further advice on how to manage that.
Great, thank you. Some patients have said that they feel like sometimes their doctor may not be able to examine or know how to approach diseases in skin of color. So what's the best way to deal with this?
This is a really hard question. So there are two components to this answer. So there's one, you as a patient being faced with a doctor who wants to help you but doesn't know how to help you, or you feel as if they don't know how to help you. So there are two things. One, that's why we have Skin of Color Training UK. And Skin of Color Training UK's raison d'etre, I'm really liking that term today, is to provide excellence in skin of color training, primarily for healthcare providers to be able to recognize skin disease in people with skin of color. So that is the first problem. The second problem in seeing your doctor is that there's a cultural competence issue. So yes, they may be able to recognize your skin disease, but the background, their background knowledge on who you are, your cultural experiences, and how that affects your presentation today is lacking. And again, Skin of Color Training UK, we're trying to increase our repertoire on this side as well, but we mostly focus on helping physicians recognize the skin disease. We're all highly trained doctors and nurses. Just to become a dermatologist on average, it takes 10 to 15 years. Certainly my training was 20 years, including research. So everyone you see, I want to say to people, no matter which dermatologist you see, they are a highly trained professional and they know what they are doing if they can recognize it. So that is what Skin of Color Training UK does, is helping our physicians to recognize what they are seeing. Cultural competence, there are lots of courses about it, but I think for cultural competence, the first thing that any person needs to do, whether or not you're a physician, is to value the person in front of you, to be curious about people who are different from who you are, and to love other people. I think if you have love in your heart and you're curious, that will come.
Yes.
Yeah, that's fantastic, and no better person to answer that.
Yeah.
But I think sometimes patients do have like a preconceived notion about who is in front of them.
Yes.
So like Dr. Taylor did mention that we all been trained to do this, and it took us years to kind of like get this experience. So come with open mind. And take it from there. Because if you don't have open mind and you already have a bias towards the person in front of you, whether it's of your skin type or not, but if you just feel like, oh yeah, well, it's not from where I'm coming from, it's not from my background, you will not understand what I'm saying, then that's a barrier already. And we can pick on that as well, because I'll pick on that when patients are holding back on information, and it's kind of like come from the fact that they have like a preconceived notion.
And when symptoms like redness are not particularly obvious in skin of color patients, are there any symptoms that they should be able to describe? Are there any words in particular or something they should be looking out for?
Basically, it is very important for patients of color to know how to describe their symptoms and the signs as well. So symptoms is easy for us to just say, I have a headache, I have pain, and that's the symptoms I'm getting. But when it comes to the signs that you can see on patient's skin, then they've become very, very difficult. And like Dr. Taylor said, we've been talking all along. We've had years to learn about all this all the time. So we have our own jargons that we use. But when you come to us, please just say to us as you see it, as you feel. Is it feeling hot? Is it feeling very itchy? Some area very thickened? We will know the jargons to use, our own terms. I mean, jargons, I mean by dermatological term to describe what you are telling us. But don't, go through the lens to say, oh, how do I describe erythema? You don't have to worry about that. Just keep it to us simple. And then we know. And as you know, we cannot, like Dr. Taylor mentioned earlier about the redness part of it, which is the main issue when it comes to skin of color. How do you recognize that? So when patient is telling me to say, okay, I'm feeling hot here, this place has been very itchy for the past 2 weeks, I've had to wake up and put some cream on that. For me, I recognize that area is the area of inflammation. That means it's really, really active, because even though we can't see it, but I understand where that patient is coming from. And when you feel the skin, you can feel the thickness. So what patient is telling me that place is becoming very rough to touch, that's kind of severe thickening of the skin. So come to us and describe it to us the way you are feeling it, because that's the way we can help you. The signs that you feel, if it's kind of disappear over time, please put it down. Put it down and just kind of say, well, in the last 2 weeks, I noticed this and this and that, because that will kind of help us as well. But keep it simple, because we will kind of get what you are saying.
Great advice. And if a patient feels like they've experienced racial bias, where should they go for help?
Very difficult. So I think the first thing I would say on behalf of the medical community, and I know I'm here on behalf of Skin of Color Training UK and the British Skin Foundation, but is very sorry. I just want to apologize ahead of time. This is not something that should be happening in this day and age, and it is wrong. If you feel that you've really felt some racial bias, particularly in an NHS setting, we have the Patient Advice Liaison Service, and that is the first port of call at the trust. You put in a complaint, and that is usually escalated right to the top until it's resolved. But there are also agencies as well where you can get further information and help, and probably practitioners who are used to treating skin of color, such as the Black Skin Directory. There's also the HS. There are a lot of patient support organizations as well that you can go to. But yeah, I think the first thing to say, very sorry, I apologize for that. There are things in place within the National Health Service that you can put in a formal complaint, and it will be taken very seriously. In fact, it's illegal, and therefore it should be dealt with.
This has been so helpful. And do you have any other tips for a patient that is attending their dermatology appointment?
Bring someone with you. A lot of my male patients often bring their wives, because women seem to be better at record keeping.
Yeah.
So bring someone with you who may either help you with your memory, a lot of times you're given a lot of information in an appointment, and it's very hard for you to process and listen and remember. And having someone with you who you trust, of course, is always helpful, not only for emotional support, but to also ensure that the message given is the message received.
Yeah.